Okay, let's look at today's question. It seems like there is a theme of insurance when it comes to TMS. A lot of people wants to know the details about like insurance coverage and what have you. That's okay. I'm here to help. All right. So the question is, does insurance allow a change in provider in the middle of the 36 treatments? Basically, that's the summary of the question. But let's look at the question that came from one of the followers on YouTube. What's your experience with insurance companies, for example, Blue Cross, approving TMS for depression if a patient already got a prior authorization approved for TMS at a Dr. A and wants to switch to Dr. B without interruption, but before the 36 sessions are over? Unlikely to be approved for Dr. B until the first prior authorization expires, and they're asking, is that true or is it not true? Okay. Well, interestingly, some patients called me Dr. B, so I'm not sure if they're talking about me or not. Sorry, bad joke. All right, so I'm Dr. Bawarshi. I'm a psychiatrist in Wesley Chapel, north of Tampa, Florida, and our practice is for the TMS Clinic. I answer questions related to TMS. If you have any questions, you can send them either to our email through the website, or you can just submit a comment in here, and I'll get to it when we make videos. All right, so this is a good question because one of the things that we want all of our patients to have, in behavioral health generally, is the choice of who they're seeing. Obviously you need to be comfortable in the clinic that you're seeing your doctors at. You're comfortable with the staff that is performing the procedure. You want to be comfortable generally on daily basis because you're doing TMS basically Monday to Friday for 6 weeks, right? So you don't want to be kind of dissatisfied, and if for some reason you want to change clinic to another clinic, or you just moved from one state to another, or from one city to the other, or your job location has changed, or any of these circumstances, then you want to be able to change the office where you're doing your TMS. The short answer is yes. You can actually change the provider of TMS from one location to another in the middle of treatment, but you need to plan these things ahead to make sure that you would not have lapse in coverage from your insurance to the new doctor, and you do not become responsible for covering the treatment sessions then. So how do we usually do this? You get evaluated by the new doctor who's going to see you. The new doctor who is going to see you would understand how many sessions you had so far, what is your progress, how many sessions left that needs to be done, and then their office manager or whoever does the prior authorization will request that number of sessions to be approved for that location. The insurance person is going to look at that and like, wait a second, we just approved you, somewhere else. What's going on? And they're going to call Clinic B. Clinic B is going to explain that this is what's going on with the patient. They want to go to a different clinic because of location, because of dissatisfaction and what have you and stuff of this sort. And then what happens is that insurance agent person will call the patient and confirm, like, is that what's going on? You want to change to another location? And the patient would say yes. I'm like, okay. And they will approve certain number of treatments, not whole 36 sessions. Say you have done already 10 sessions in Clinic A, then they were going to say, hey, you have 26 sessions left that can be done at Clinic B, okay? And then once you have that green light, then you can switch your treatments to be continued in Clinic B. Just a word of caution, just make sure that you plan this ahead and do not stop seeing Clinic A and have a gap in your treatment before you go to Clinic B. It could not jeopardize your improvement. Again, I said it could and could not jeopardize your improvement. There is a little bit of controversy about stopping treatment and not stopping treatment, whether it affects your improvement or not. That's a topic for a different video. All right, okay, so the answer to this question, yes, you can switch clinics. It's better be a very good clinic, the one that you're switching to know exactly the details, so you would not have any gap in your coverage of the prior authorization from the first clinic to the second clinic. All right, hopefully this helps. Disclaimer. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.